Breast health is a cornerstone of overall well-being, yet it is often overlooked until discomfort or alarming symptoms arise. The importance of regular checkups and self-examinations cannot be overstated, as they are the first lines of defense against breast diseases, including cancer. While modern medicine has made remarkable advances in diagnosis and treatment, early detection remains the most effective strategy for ensuring successful outcomes. Cultivating breast health awareness is not solely a matter of medical vigilance. It is an act of self-care, empowerment, and responsibility that reverberates through families and communities. Understanding the necessity of regular breast checkups begins with recognizing that many breast conditions are silent in their early stages. Breast cancer, for instance, is most treatable when detected before it has spread beyond the breast tissue. However, early-stage cancers often present no pain or visible changes, making routine screening essential. Clinical breast exams performed by healthcare professionals can identify subtle abnormalities that may escape notice during daily life. Mammography, the gold standard for breast screening, can detect tumors too small to be felt, as well as microcalcifications, tiny deposits of calcium that sometimes indicate early malignancy. For women at average risk, annual or biennial mammograms are typically recommended beginning at age 40, though guidelines may vary based on individual risk factors. For those with a family history or genetic predisposition, earlier and more frequent screenings may be advised. In addition to professional assessments, self-examination is a vital tool that empowers individuals to become familiar with their own bodies. Monthly breast self-exams help establish a baseline understanding of one's normal breast texture, size, and appearance. This familiarity makes it easier to notice any unusual changes, such as lumps, thickening, dimpling of the skin, nipple discharge, or persistent pain. While not all changes signal cancer, many benign conditions can cause similar symptoms. Promptly reporting new findings to a healthcare provider is crucial for timely evaluation and peace of mind. Self-examination should be performed at the same point in the menstrual cycle each month, ideally a few days after menstruation ends, when hormonal influences on breast tissue are minimal. For those who are postmenopausal, choosing a consistent day each month is helpful. Despite the clear benefits, misconceptions and barriers often hinder participation in regular breast health practices. Some individuals may fear discovering a problem, while others believe that only those with a family history need to be vigilant. In reality, the majority of breast cancer cases occur in women with no identifiable risk factors. Additionally, breast conditions are not exclusive to women. Men, though much less commonly affected, can also develop breast cancer and benefit from awareness and prompt evaluation of changes. Cultural attitudes, lack of access to healthcare, and misinformation can further impede proactive breast health. Addressing these barriers requires education, community support, and advocacy to ensure that everyone has the knowledge and resources needed to prioritize their breast health. Routine checkups and self-examinations are also valuable for identifying non-cancerous breast conditions. Cysts, fibroadenomas, infections, and hormonal changes can all lead to lumps or discomfort. While most of these are benign, distinguishing them from malignant growths is essential. Early evaluation allows for appropriate management, whether reassurance, monitoring, or intervention, and alleviates anxiety. Moreover, regular contact with healthcare providers creates opportunities to discuss other aspects of breast health, such as risk reduction strategies, lifestyle modifications, and the impact of reproductive choices or hormone therapies. The psychological impact of breast health awareness should not be underestimated. For many, breasts are closely tied to femininity, sexuality, and self-image. Anxiety about potential illness, body changes, or medical procedures can be profound. However, knowledge is a powerful antidote to fear. Understanding what is normal, recognizing warning signs, and knowing when to seek help fosters confidence and control. Support groups, counseling, and open communication with healthcare professionals can further ease emotional burdens, encouraging a holistic approach to breast health that addresses both physical and mental well-being. Advancements in technology have expanded the options for breast screening and diagnosis. Digital mammography, ultrasound, and MRI offer increasingly detailed images, improving the accuracy of detection, especially in women with dense breast tissue. Genetic testing can identify individuals at higher risk, allowing for personalized surveillance plans. Yet, even as technology progresses, the fundamental principle remains unchanged. Early detection saves lives. No machine or test can replace the value of personal vigilance and partnership with healthcare providers. Lifestyle also plays a significant role in maintaining breast health. Regular physical activity, a balanced diet, moderation in alcohol consumption, and avoidance of tobacco can all reduce the risk of breast disease. Maintaining a healthy weight is particularly important, as obesity is linked to increased risk of breast cancer after menopause. Breastfeeding, when possible, has been shown to offer protective benefits against certain types of breast cancer. Being mindful of these factors complements the practice of regular checkups and self-examinations, forming a comprehensive approach to breast health. Education is the foundation of breast health awareness. Schools, workplaces, and community organizations can play pivotal roles in disseminating accurate information and dispelling myths. Public health campaigns, survivor stories, and accessible resources encourage open dialogue and reduce stigma. When individuals are equipped with knowledge and supported by their communities, they are more likely to engage in preventive behaviors and seek care without delay. Ultimately, breast health awareness is a lifelong commitment that evolves with age and circumstance. From adolescence, when education about breast development and self-examination should begin, through the reproductive years and into the older adulthood, vigilance must be sustained. As bodies change, so too do the risks and recommendations for screening. Staying informed, remaining attentive to one's body, and fostering a relationship with trusted healthcare providers are the pillars of effective breast health management. In embracing regular checkups and self-examinations, individuals take an active role in safeguarding their health. These simple, proactive steps have the power to transform outcomes, turning what might have been a late-stage diagnosis into an early, treatable condition. Beyond the individual, the ripple effects extend to families and communities, promoting a culture of wellness and resilience. By making breast health a priority, we honor not only our own bodies, but also the collective strength and wisdom of those who have come before us and those who will follow.